I want to introduce another speaker to you who can help underscore why this moment is so urgent and why it doesn't have to be this way, and that's Tim Foley. He's a blogger for Change.org, and he also is the Health Policy Director for NYC for Change.
Okay.
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
When do we want it?
Now!
When do we want it?
Now!
When do we fight?
Now!
When do we win?
Now!
Good morning, New York! Good morning, move on!
Good morning.
We have been at this a long time.
Too long.
I don't just mean this latest effort to give every American access to high-quality, affordable health care as a basic right and not as a privilege. I mean the decades of attempts by presidents of both parties to make American health care more affordable, less costly, of better quality, more fair, and more just. This morning, right now, we are still closer to that goal than we have ever been before.
Yes!
The president has likened it to being on the 2-yard line. Well, it doesn't matter if you're a Jets fan or a Giants fan or, God love you, a Buffalo Bills fan. You know that when you're on the 2-yard line, you don't give up. You step up. You make the play and you get it done. And that's what Congress needs to do now. Now! Here in New York City, we're lucky that all but one of our members of the House has already stepped up. And we're lucky, too, that both Senator Gillibrand and Senator Schumer have pledged that they are going to finish this fight. And we're lucky because we know that there are plenty in Washington who think it's time to give up.
Right.
Healthcare reform, it's just too hard. It can't be done. The lobbyists, the insurance companies, the Tea Partiers, the Chamber of Commerce, they're all just too strong. And there are plenty of so-called progressives and so-called Democrats who already voted for healthcare reform, but who don't want to stick their necks out one last time to get a bill passed. Why? Because they don't think it's worth it. They don't think it's worth it, once and for all, to guarantee that no insurance company can deny your coverage or limit your care because you have a pre-existing condition.
They have health care.
They don't think it's worth it to say to Aetna and United and Blue Cross, guess what? You can no longer use someone getting sick as an excuse to drop their coverage. They don't think, somehow, that it's time we finally made coverage that's not just as good as a member of Congress, but actually the same as a member of Congress, available and affordable to every American. They don't think it's worth it to pass a bill that helps seniors who are falling into the Medicare donut hole, helps small businesses buy coverage for their employees with tax credits, would eliminate all co-pays and deductibles on preventative care for everyone, and would do all of this while bringing the deficit down. Not up, but down. How can they not think it's worth it?
Because of pressure from the big
That's a good theory. Now, Senator Schumer and our congressional delegation looked at where we are now, and they looked at where we could be. And they said, of course, it's worth it. And to them, I want to say 2 words. Thank you.
Thank you! Thank you!
But to all the naysayers, whether they're politicians more interested in their own poll numbers than solving problems, or whether they're the pundits who love to focus on the fight in Washington, but never consider how our broken healthcare system is hurting people like Eric outside of Washington. And yes, whether they're some of our own friends and family, New Yorkers, who somehow think we won't benefit if reform passes, who are either misinformed or misguided about what reform will do, well, to them, I have two other words. Wake up!
Yes!
Because you don't need to look into the future to understand the cost of failure. The warning signs are all around us. They're already here. You just have to wake up and look. Last week, just one example, the insurance companies in New York State just told us that they're going to raise premiums on small businesses by an average of 11 to 17% next year. And one of them wants to raise it by 66%. Wake up! Wake up!
Wake up! Wake up! Wake up! Wake up! Wake up!
This year,
Wake up! Wake up!
this year, 500,000 New York seniors in our state will fall into the Medicare donut hole. And that means that they are just months away from having their prescription drug coverage cut off for the rest of the year. Wake up!
Wake up! Wake up! Wake up! Wake up! Wake up!
In Manhattan, St. Vincent's Hospital, the hospital where 9/11 victims and first responders were rushed to, is facing its second bankruptcy because they can't afford the amount of uncompensated care they rack up every day. Wake up!
Wake up!
Wake up! Wake up!
Wake up!
Wake up!
Right here in New York City, there are families who are working hard. They're paying their taxes. They're playing by the rules. And they have insurance. But despite all of that, they are still only a cancer diagnosis or a catastrophic illness away from having their security wiped out. I know some of their stories. I know some of them personally. You do too. And they don't have the option of quitting. They're not given the choice to head for the hills and say, it's not worth it. We'll take care of this later. They don't have the luxury of waiting anymore. So neither should Congress and neither should our president. We've been at this long enough. It is not time to give up. It is time to step up, and it's time to finish the job. Let's get this done.
Now! Healthcare 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 now!
Healthcare now.
So we have conveyed this message to Senator Schumer and Gillibrand. We met with both of their offices last week. And we're going to go back today and bring these new surveys that show what's happening in the grassroots and the disenchantment that's growing there. And it's what Tim said is right. It's time for them to stand up and take that lead again. And we know that it's in their heart. We know that this is what they want to do. They just need a little bit more encouragement. So we're going to go encourage them. I urge you all to keep calling their offices, thank them for their work so far, and urge them that now is the time to stand and fight for health care. We are so close.
That's right.
So close. So thank you all. Thank you all for coming. And we're going to go now bring the surveys in. Everybody have a great day. What are we doing now? We're going to work. We're going to work
to make money and pay for our premiums and our taxes.